There we go. Good evening, everyone. It's Fertility Talk Live. We're just going to wait for you guys to join us. It is our second, hi Adele, it's our second Fertility Talk Live. Thanks for everyone's coming on. So I'm just going to, Adele, I'm going to chat to you now. I think Adele's coming on now. See you. There. Okay, here we go. Hi, Adele. Good evening. Good evening. I'm just waiting for a few people to join us as they're getting the notifications, and then we can start. So just thanks to everyone's joining us. Liesel, Fatima, thanks for joining us, Fatima. Just waiting for all my usual people. Gia, everyone. So guys, we're talking tonight to our second fertility talk for the month of January and for this year. Tonight we're talking to Adele. Adele is from FutureGen Labs. I'm sorry, my voice sounds a bit different, guys. I've been sick for 2 days, but I'm here. I am here. So, yeah. We're talking to Adele, and tonight we're talking about, can genetics play a part in my IVF treatment? So for those of you that are currently going through IVF treatment or planning on IVF treatment, it's definitely something you need to listen to. Adele is from FutureGen Labs, and she's going to basically give us a bit of background. We've got a few questions for her. So Adele, welcome to your first fertility talk for this year. The first one for this year, I'm going to say, because we're going to do more with you. Can you hear everything perfectly? Is everything fine on your side?
I can.
Okay, perfect. So the question we asked is, can genetics play a part in my IVF treatment? And to start with, can you please just give us a bit of background about who you are and the services you provide, where you're based?
Okay, we're based in Joburg. We were born through COVID, during COVID, not because of COVID, but our holding company is a medical supplies company in South Africa, so they were very much in the medical arena. And one of the directors went through an arduous IVF fertility trip, so to speak, for journey for about 5 years. And one component of this IVF journey was that there had to be a lot of genetic testing done just to take away those factors from the infertility that they were suffering. And they found that either it was very expensive in South Africa to do the testing, or that you had to send testing overseas. And because they were in the medical space, they decided, you know, enough South Africans deserve to have affordable genetic testing, bought some machines. I came along. I have a background in biochemistry and genetics. That's what I did at university. I did get involved in business afterwards. So I had the theory knowledge and the business knowledge. And so I think in March of 2020, we actually flew overseas to go check out the genetic labs out first. And we decided to start building one. I think we started building it on the 1st of March. And then I think it was round about the middle of March that we shut down. But that didn't deter us. We built it and we were up and running. I think we opened our doors on the 1st of August 2020. And, you know, we started contacting IVF labs in particular around South Africa, and started providing genetic services in the reproductive genetic space. So that's who we are. We're located in Johannesburg. We're found in Johannesburg, but we service across South Africa.
And then what is genetic testing? Everything done through that.
Okay, so let's put it in really simple terms, because nobody, you know, nobody's a professor here, including myself. So we know when we talk about genetics, we talk about inheritance, and we all know that we inherit from our parents, right? We get half from our mom and half from our dad. And this affects everything about us. It affects the color of our hair, our eyes, even your tongue. Okay, the way you can curl your tongue is a genetic trait. Now, what genetic testing does, it looks at what was inherited. And if we have inherited something that might adversely affect us, or disturb our well-being today. And when we talk about genetic testing, that's very, very broad. You have genetic testing in oncology, in cancer, to go see, what is happening there. You have it in cardiology. You have it in virology. Believe me, all the COVID testing, for us to check if we have COVID, is genetic testing. It was looking for the virus and thing, and that's why you keep on hearing about the mutations about COVID, right? So it's exactly that. And focus on reproductive genetics, which means that we look for structural changes in the genetics of the embryo, as well as any inherited diseases that might affect your baby. So to mention, when we talk about genetic disorders, you can have genetic disorders that are passed on. Those are inherited genetic disorders. And you can get spontaneous genetic disorders. So like an inherited one, for example, would be hemophilia, which is a type of blood problem where you can bleed, God forbid, to death. A spontaneous genetic disorder would be something like Down syndrome.
Okay.
So,
sorry, there was a bit of a delay with your video at the moment.
Yeah, unfortunately, I'm getting a call that's coming through all the time. So I'm
and that's causing the delay. Sorry, but no worries about that. Okay, so sorry, are you done, are you done, Adele?
Yes,
okay.
I am.
So the next question is, why would I need it? Did we go through that? No? Yeah, why would I need genetic testing?
Yeah. Why would you need genetic testing? So there's 3 reasons why you would look at genetic testing as part of your IVF journey. First of all, the older you get, the higher the chances of having a child with genetic disorders, okay, such as Down syndrome or miscarriage. So, and the risk greatly increases in women 36 years and older. It's called MAA, advanced maternal age. So as soon as you hit 35, 36, your chances of having a child with a genetic disorder increases exponentially. So that's why you should go for genetic testing. Another is if you have a recurring miscarriage. We suggest that if you have more than one miscarriage concurrently, one after the other, you should check to see that this is not for genetic reasons. Now, of course, there could be many reasons why you're having a miscarriage, but you should take out this idea that it is because of a genetic disorder. You need to rule that out. So if you're having recurrent miscarriages, it's a good idea. And of course, as always, a miscarriage, we're only one component of a healthy pregnancy. And I have to emphasize that we're not the be all and the end all. The third reason why you would go for genetic testing, if you know that in your family you've got an inherited genetic condition and you don't want to pass this on to your child, then there is testing that we can do, and there is selection of the embryos that we can go through to ensure that that genetic disease is not passed on to your child.
How do I, if it's okay, we had a chat a while ago and you explained to me why genetic testing is important a few days ago. And you gave me the example of when you're doing IVF and the eggs are in the lab and you want to make sure that the best egg is put back. Is it maybe something that you could go through with us? And that was such a good, it actually stuck with me.
Basically, okay, so how do you, basically you're asking, how do I get tested and how does this testing occur? So first of all, to let your audience know, you can't come directly to us and say, test me, right? We are a cog in the wheel of the gynecologist that's looking after you, or the IVF lab that is looking after you. So they're the ones that are looking after you and trying to get you to the point of having a healthy baby. So you can't order the test yourself. What happens, let's take the 2 scenarios. In the case of a miscarriage, okay, unfortunately, at the time of evacuation, when they are removing the embryo from the woman, what they will do is they will send a specimen of the fetus to us, and we will check to see if there was any genetic disorders. okay? And that is at the time of miscarriage. So if you've had concurrent miscarriages and it's over and done with, you can't go and
Yeah.
say, well, now test me. Okay, we'll talk about that a little bit later because we're bringing out new stuff that you can do that. But in terms of the miscarriage, it has to be at the time of evacuation of the embryo. Then a specimen is sent to us and we will say, we can tell you whether this baby was genetically healthy or not. Alternatively, while you're going through the process of IVF, everybody knows we go through the process of fertilization, and then there's implantation back into the uterus. Before implantation, after fertilization, around about day 5 and day 6, very skilled embryologists are able to take a biopsy of the structure that will become the placenta. Okay, so I want to stress out there, everybody thinks you're poking my baby. We're not poking your baby, we're not hurting your baby. It's a biopsy, it's a little slither off that which will become the placenta, which is obviously part of the baby and holds the same genes as the baby.
Yeah.
And that is sent to us, and we genetically test that. So what happens is you'll go through fertilization, then day 5 or day 6, the embryologist in the IVF lab, or if you've got a specialist gynecologist, will do the biopsy. The biopsy will come to us, and around about 2 weeks later, we will be able to tell you these embryos are genetically healthy. These ones we don't advise for reimplantation. And that actually helps a person to know that that which they're implanting back again in the first instance is healthy from a genetic point of view, and you've ruled out that you're not going to miscarry, or God forbid, carry to full term a child who has a genetic disorder.
Why I said I like it is because IVF is such an expensive process. So what happens is, I'm talking from my side of things, is you go through it the first time. It's you're playing, like you said to me, it's like you're playing Russian roulette. I remember everything you said. You're playing Russian roulette and you're choosing, oh, let's try this egg. Let's see if this egg is actually going to work. They put that egg back and now it doesn't work. But with genetic testing, you can actually see that, okay, this egg that is being put, this embryo that's being put back in my uterus has the best chance of surviving and actually you carrying your baby to term. So for that reason, I love the fact that we're discussing this and bringing it out there to women, knowing that, this is available for you, especially when you've had 2, 3, 4 IVF treatments, and going through. And like again, IVF treatment is extremely expensive. So I'm very glad that you brought this up. So if we can go to the next one, is what makes FutureGen Labs different from what's out there already?
Well, so basically it's the way that we structured our costs and our packages. So exactly what you're saying is we don't want our patients to play Russian roulette. So everybody knows when you're going through IVF, they're going to do a stimulation. You're going to produce 16 eggs, 20 eggs, and then they're going to fertilize it, and that's going to fall down to 10 eggs, 8 eggs, 4 eggs, whatever it is. And which eggs are going to survive. Now, in us trying to encourage people to go through genetic testing, what we have done and what sets us, makes us, so to speak, special in the space, is that we're trying to encourage people to go with what we call a test all scenario, meaning we've made it affordable enough that say you've got 8 eggs, because it's not as expensive as it has been in the past, okay, from other providers, you can go and test all 8. And let's say, for example, we come back and we say, there's 3 that are healthy, 5 that are not. Psychologically for the mother, she knows she can put away, like just file away, 5 of them are not viable in the first instance and make peace that I have 3 left. And then you can work with the 3 healthy, genetically healthy children. And, hopefully the first one they implant allows you to have carry a baby to full term. And that also allows you can then freeze them with your fertility center. And in 2 years' time, you saw that, and then you don't have to go through the entire process again. So it takes away the Russian roulette. So what we've done is we've kind of like made it fun. We've made it like fruit.
Yeah.
We've got a cherry package that's from 1 to 3 embryos. Then we've got a grape package, which is 4 to 7 embryos. And then we've got a pomegranate package, which is eight or more. And which the packages go down in price. So, you know, you start at very low, 3,000, and go down into 2,000 or 2,900 when you get to the pomegranate. And we really, really encourage people, don't play with your emotions. You know, don't sit there at night thinking you've got something in the freezer, you know, something's there, there's a hope there, and really there is no hope. Like, be practical about it and understand what it is. You and your doctor understand what it is that you're working with, and work with that which is healthy. So that really like sets us aside. What we've done this year as well is we have brought in what we've called our Pomegranate Plus package, which we do recognize when you have 8 or 10 or 12. I think the most we did was about 14 embryos. It still is an expensive process. You know, it's not a R9.99 process. What we do then is we say, well, let your doctor choose the 3 or 4 most viable embryos. We'll do full testing on those, let them biopsy the rest, and we'll store them. We call it store and amp in our laboratory. Hopefully, please God, one of the 3 or 4 embryos that you've tested will lead to a healthy pregnancy. If not, we've got in storage the other 9 or 8 or whatever it is, and we will pick the next 3 and put it through the final testing. So, because you can't go back once there's fertilization and you go past that point where you've frozen them at the IVF lab, you can't go then thaw them and do the biopsy. The biopsy has to be done after fertilization.
I've just got a quick question, now that I'm thinking of it. So we're always trying to promote that women try and freeze the eggs as soon as possible, you know, especially if you're going to be studying further or you're busy working on your career. When you get to 25, 30 and you want to freeze your eggs, rather do it then, so you have a better chance of conceiving. If you decide at 35, 40 to have a baby, your eggs are still 30. Would it then be in their best interest also to have this done, you know, when they're going to freeze the eggs?
Okay, so we don't do what we call PGTA, which is pre-implantation genetic testing for aneuploidies on eggs. We do it on an embryo already on the 5th day of fertilization. Okay, so that is then. What we are going to be doing, though, is that we are going to be bringing it, and that comes to kind of like a lead into your next question of what new packages. We're bringing out 2 new packages. One is carrier screening. Now, this is more, so to speak, a preventative genetic screening, as opposed to something that you have to do because, you know, you're following a process. Carrier screening is going to allow couples before conceiving, number 1, to go and check themselves to confirm that they haven't got a genetic disorder, that when the 2 of them come together to produce a child, that they're not giving something inherited. And I have to stress, like with a shout out, each and every one of us carries genetic disease or a genetic something. Okay, we all know. You know, you'll hear women laugh. You know, I always get fat in my hips. Well, my mother was like that, and my grandmother. Well, that's genetic, right? Everybody carries genetic disease, and it does not mean there's something wrong with you. What we're trying to do with carrier screening is to say, you've got your genetic profile to the female, you've got your genetic profile to the male, or however the couples are going to work. When coming together, we want to make sure that there aren't genetics on either side, that when coming together, or one is dominant and one thing, that you're going to have a genetically ill child. So we're bringing out carrier screening, and basically this testing will be to minimize the risk of both parents being a carrier of a potentially detrimental disease. And as well, what we are going to be doing for people who are getting donor eggs or donor sperm, we're going to be working with those banks and maybe giving a certification that that donor egg or donor sperm has gone
Yeah.
through carrier screening. And before you go and buy that as part of
Yeah.
your package, we will check you to see that you are compatible with that. So again, genetic screening as a preventative thing would be good for anybody, whether they're freezing their eggs or not. It's got nothing to do with the fact that I'm
Yeah.
going to freeze my eggs. You could be 22 years old and be very healthy. Just check your genetics. It's just have information at your hands.
Okay. Okay. So, are there any? Okay. So that actually the last question. Any new test that FutureGen will be launching? Yeah.
There's one other test I'd like to mention, and this is quite a complicated one, but it's around what we call endometrial receptivity testing. So most women have a well-defined time frame when
Yeah.
implantation can occur, okay? And it's basically based on hormonal levels. Now, some women, that goes haywire due to
Yeah.
some genetics, okay? Which you would never pick up, but genetically it stops you from having the correct time frame, or a time frame that is not the same as it normally is. So what we will be doing is we'll be able to be taking a biopsy from the endometrium, right? And we will be looking at the window of implantation by looking at the genetics of the endometrium, and that will give information to your doctor when it will be the best time, the optimal time to implant the embryo. So we're going to be bringing out that test as well. So that's very specific. Obviously, again, it will be under the guidance of your IVF lab or whoever is trying to help you on your fertility journey. But it is another place where doctors have come to realize genetic plays a part in implantation.
Wow, that sounds amazing. Thank you, Adele, for spending the time and doing this talk with us. I've learned quite a bit, and I'm sure there's quite a few women that has joined. And I've seen one of the fertility specialists from another clinic has also joined. That joined, doctor. He's actually seeing he's online and watching us. So thank you very much for doing the talk. Again, could you just explain to women if they are looking at doing this, doing the genetic testing, what is their steps? Who do they go and speak to?
They have to go through their reproductive gynecologist or through their IVF and have the discussion with the doctor. And they have to weigh out, a whole lot of determinants in order to decide, should they go for genetic testing. As said in the beginning, generally we're more focused on the older group of women, and I'm not being insulting to anybody calling you older if you're 35, but that is where, there is the propensity for one to have more of a worry about the genetics of the baby than if somebody is young. But you'll be guided by your doctor, and we obviously, follow in tandem with the doctor's treatment of you. It's not something you can go out. When we'll bring out carrier testing, that's going to be to your own prerogative, and it'll be direct to the public. But what we're doing right now, which is called PGTA testing, that has to go through your doctors. If we're checking after miscarriage, it's called products of conception. The doctors call it POCs, and that too, obviously, is under the auspices of your doctor.
Awesome. Thank you very much, Adele, for taking the time and doing this talk. We hope to have you back soon again. Thank you for everyone else who joined us this evening.
Thank you.
We'll see you guys next week. So what Adele is actually doing, what FutureGen Labs are doing, is they are giving away free embryo testing for to one patient for 3 embryos. Is that correct?
At a specific clinic for now. We're not giving it away.
At a specific clinic at the Cape Fertility Clinic in Claremont. So they'll be giving it away at that clinic to a patient. And we thank you for that, Adele. It's very kind and generous of you for doing that.
No problem. If anybody would like to find more information, they can go to our website. Yep. It's www.futuregenlabs.co.za. Our contact details are on there. We're on all social media. Just search for us, FutureGen Laboratories, and we're glad to help answer any questions. Just just to mention that we also are in association with genetic counselors. So if it is a, you know, a bigger issue, something that you need more
Yeah,
information about, we can definitely direct you
awesome.
in the right direction.
Thanks, guys. We'll see you back next week at 8 p.m. again on Instagram Live. We will do another fertility talk with Dr. Suleiman Hayden from Cape Fertility Clinic. Thanks, guys, for joining, and have a good evening. Thanks, Adele. Bye.